Parkinson's disease is a very common disease that can be quite debilitating in many patients. And I always remember that when I was learning it in medical school, there were all these terms like the pyramidal tract, extrapyramidal tract, etc., which didn't really seem to make that much sense to me. So I've tried to simplify it as much as possible and give you just the basics of neuroanatomy that you need to be able to understand Parkinson's disease. So here we have a cerebral hemisphere, and we have the primary motor cortex. So the primary motor cortex sends fibers down towards the pyramids in the medulla, and the reason that they're called pyramids is because the fibers all converge, sort of like an upside-down pyramid. And then we have a couple of different tracts. We have the corticobulbar tract that is responsible for various muscles in your head and neck, and then we have the corticospinal tract, which is responsible for the rest of your voluntary movement. And then we have the extrapyramidal tract, and that's a group of different parts of the brain, mainly the basal ganglia, cerebellum, and vestibular nucleus. And the purpose of the extrapyramidal tract is to regulate the movements and try and smooth them out as much as possible. So the extrapyramidal tract is involuntary. So whenever you decide to make some sort of movement, let's say to catch a ball or something like that, the pyramidal tract and the primary motor cortex was responsible for initiating that movement. However, the extrapyramidal tract does quite a lot of stuff in the background to make that movement as smooth as possible. So one analogy I've heard of before, which made this whole thing make a lot more sense, is to think of the pyramidal tract as the accelerator in a car, and to think of the extrapyramidal tract as the clutch. So anyone who's driven a manual car will know that there is this thing called the bite point, which is the point at which the clutch and the accelerator are in just the right amount of balance to get the car to move smoothly. And that's the purpose of the extrapyramidal tract, is to give you a clutch to make your movements smoother. So if we focus on Parkinson's disease now, it's defined as a neurodegenerative disease of the dopaminergic neurons of the substantia nigra, and the cardinal symptoms are a resting tremor that's usually asymmetrical, rigidity, bradykinesia, and postural instability. So you can see that all of these are movement-related problems, and it's because the extrapyramidal tract is not working quite as well as it should. There are a bunch of other symptoms as well which are associated with Parkinson's disease, such as insomnia, hypomimia, so the lack of facial expressions, depression, and autonomic dysfunction.